Okay, so this is the local coordinating council for Boulder County, and this is the first time that we've tried a fully remote meeting. I see that we have about 37 people on the call, and so we'll go through and let everybody have a chance to introduce themselves. But first, I would like to do some housekeeping before we do this. And if you can't hear me or something goes wrong, if you could type in the chat, that would help us keep track of some of the technical difficulties that we may have. So I just want to talk about Teams. So we're using Microsoft Teams, and it might be a little bit different from Zoom or whatever other platforms you all are using. So you would have gotten something similar to this in the invite, and you could have clicked on Join Microsoft Teams, and that you could open that in the browser, or you could also open it up in the app. So it's you don't have to download the app if you don't want to. And then there's also a call-in feature. And if you're calling in on your cell phone, if you just click the blue area there, it should automatically account for the call-in conference ID, which makes things a little bit easier. That way you don't have to toggle between different screens. But since you're here, I'm assuming that you all navigated that perfectly. Another thing also that I want to say is that everybody should be on mute, just to kind of eliminate some of that background noise. And we get into points where we have some echoes sometimes, which I'm sure a lot of you have dealt with that situation before. Also, I'll be taking notes about this call afterwards and sending them out to you all. And I have recorded the notes because it is just me right now, so I might have to go back and reference the call to see if there's any changes that I need to make to the notes. And then if you want to see who else is on the call, you can click on this little person icon, and it will bring up a panel to the right-hand side, and then it will list people alphabetically as they are in the call. If people are calling in, though, it doesn't list their name, it just lists their phone number. So we'll go ahead and get started. So this is the LCC meeting, the Local Coordinating Council. We meet the second Monday of the month. We skipped last month because I was moving, and then the COVID crisis happened. So we will be meeting virtually until the COVID crisis is over. But we do alternate odd months in Boulder and even months in Longmont. That's actually backwards this year, though, so there's a mistake on that slide. So the purpose of this is really human services transportation focused. This meeting, we focus on getting people in the out of the vulnerable and crisis mode with their transportation options to stable, safe, and thriving. So we really do focus on transportation being that linchpin service that allows people to access all other aspects of their life. And we really do take a multimodal approach. And by multimodal, we mean options, transportation options for everybody. Because if people rely on one mode of transportation solely, then they become pretty vulnerable, and they could be in crisis if one of those modes fails them. So today, our agenda is introductions. Then we're going to have some critical COVID-19 updates from the different stakeholders on the call. And then we're going to have an update on the Census 2020, a short update. So these are the updates from the members that we are going to hear from later on. But at this point, I would like to encourage people to introduce themselves. So I will call out people. That way we don't have people popcorning in and speaking over each other. So go ahead, and when I call your name, you can unmute yourself and you can say your name, what organization you're with, and then what major changes have happened since the COVID-19 outbreak. So the first person I have on my list is Erin. So Erin, if you want to unmute yourself and give us an update, that would be great.
Yeah, so I work for Center for People with Disabilities. The major change that we've decided, is a lot of it is work from home, on virtual platforms, Zoom, Google Hangouts, GoToMeeting through Microsoft. A major change that we've implemented is virtual peer groups. So really connecting with people in the community through peer support groups, virtually through Google Hangouts, and then still providing all of our core services as normal, just not face to face. A lot through email, a lot through Google Voice and phone calls. Yeah, that's about it.
Great, thank
Daily
you.
peer groups.
That's wonderful. So next on my list, I have Anna.
Hi, this is Anna Stewart. I'm with Boulder Valley School District, and as you can imagine, trying to educate 33,000 students online has been quite a rigmarole. I think we're overall doing quite well, but there's the subgroup of our students most affected by disabilities that are definitely some big struggles in the home front. So we're continuing to adjust and look at other ways we can support them, what other resources are out there, really trying to pull the net in so we can keep these families, whether they're learning or not, is secondary to keeping them sane in their households. So I think that's kind of the main one. And teachers are continuing to adapt and figure out how to do this. Some families are actually reporting an increase in engagement from their students, particularly those with social anxiety, are really happy to not have to face the school day and are doing a lot more schoolwork. So there's all of the above.
Yeah, definitely a learning experience for all of us.
Yes.
Great, thank you. So Aaron Bartel is next. And if you could unmute yourself, that would be great.
Thank you. So sorry about that.
No worries.
It's Ann Bartles with Pasco. We're a home health agency, and right away what we've done is switched over to telehealth. So we are serving all of our clients and caregivers that way, along with electronic signatures, which makes it easier for all of our clients. We do have a COVID-19 hotline that people can call at any time if there's any questions that they have or symptoms they might be experiencing. And we also have a Pasco 19 basically talks, where we can have some of our caregivers and clients reach out to us that might be feeling isolated and talk to us, play games. We're looking at implementing a trivia game right now, looking at platforms. So if anybody has a really good one that works, please let me know. But that's some of the things we're doing now, as well as still hiring family caregivers during this time.
Oh, great. Thank you. So next we have Bill Sweeney.
I'm sorry, I bobbled the unmute. This is Bill. I'm with the Boulder Bridge House, along with the other sheltering organizations in the county. We've all undergone some significant program changes in the last 2 weeks. Also here at the Bridge House, we have lost all of our external business of running cafes and doing catering, but we have filled that gap by supplying a great deal more in the way of food products to other sheltering agencies that are popping up or having different needs at this point. If any of you, by the way, would like to investigate receiving prepared food from us, please get in touch.
Great, thank you, Bill. Brandon, you're next on the list.
Can you all hear me okay?
Yeah, we can.
Okay. Hi, everyone. My name is Brandon Stepter. I'm the community liaison for the Colorado Community Health Alliance for Region 6. One of the biggest changes that we've had is just getting a lot of our behavioral health care providers, getting them set up on telemedicine and figuring out how that's going to work for them, and then just coordinating their billing procedures and making adjustments around that to make sure that folks can still have access to their behavioral health providers. That's just kind of one of our main priorities right now that we've focused on changing.
Okay, wonderful. And we will get into a little bit later an update on transportation or a discussion on transportation for people experiencing homelessness.
Awesome.
Because, yeah, I know that you were wondering about that as well.
Yep.
So next we have Carrie Murphy. If you want to unmute yourself, that would be great.
Hi, everybody. So I'm Carrie Murphy. I'm with Boulder Housing Partners. And a lot of the stuff that I'm working on is helping our staff to try to come up with ways to deal with paperwork around certifications, move-ins, move-outs, without actually having to have face-to-face meetings with people, or limiting face-to-face meetings with our customers as much as possible. So that has really changed. Just not being in an office where someone can walk in and ask a question is really different now. So
Yeah, I bet.
Yeah.
Great, thanks. Next, I have Catherine.
Hi, I'm Catherine with Commuting Solutions. And right now we're all working remotely and kind of working to pivot some of our programs and services. We're doing a webinar series. We have one coming up on Wednesday with RTD about some of the service and safety changes in our region. We've also put together a resource page on our website. We're trying to keep up to date with some key transportation updates and just general resources for the members and our general community. And then also just putting some surveys out there to learn at this point. So we've got a telework survey open just because I feel like that's going to be a big new focus for us as an organization. Yeah, that's it for now.
Wonderful. So Christy Britt, you're next.
Great. Hi, this is Christy Britt with Cultivate. Our snow program is up and running, so people were out shoveling today. The yard program hasn't started yet. Our medical transportation is still continuing for those appointments that have not been canceled by the providers, but we're calling all of our clients just to make sure if they are still scheduled, or to have them proactively call and check. Our home modification program maintenance is really more on an emergency basis, and by emergency I mean if they have like an actively leaking pipe versus they just need something passively fixed. And those are certainly up to the volunteers, their comfort level on going into homes. And then our grocery program is doubling in size each week, and really we've put in a lot of extra safety measures to make sure those groceries are cleaned and delivered in the most sanitized way possible. And in fact, that program is expanding into Broomfield County, where we'll start an on-site service there next week as well.
Wonderful. So we will have another opportunity for you to go a little bit more into your carryout caravan. I know we had emailed back and forth, but that'll be after the introductions.
Perfect.
Great. So next I have Craig Towler.
Hello. My
Hi,
name
Craig.
is Hey, my name is Craig, and I'm doing census outreach for the Center for People with Disabilities. And our outreach has really kind of just had to adapt to more digital platforms and joining in meetings. And I'll have some more time to speak at the end to kind of give a rundown of the census and the importance of it and how we're trying to focus the outreach specifically to people living with disabilities and increase participation.
Great. Thank you, Craig. Next, I have Dennis. Dennis Whalen.
Hi, Angel. This is Dennis.
Hi.
I'm with Peak to Peak Housing and Human Services. So far up here across the Peak to Peak region, we've experienced at least 3 times the demand for food from our food pantries. We've set up conference calls with the primary people. That's EFA, the Our Center, Center for People with Disabilities, Teen Center, our city manager, and so forth to coordinate our efforts. Part of that, we've arranged for a helpline for people to call that need somebody to pick up groceries or prescriptions for them, people, particularly more elderly people that don't want to go out and get food or pick up their prescriptions and want to stay safe and stay home. The seniors up here are also delivering meals. And we're working with the census folks to try to get the people up here to sign up for the census. I think that's about it for the moment.
Great, thank you. Next, I have Dinah Pollard.
Hi there. Can you hear me?
Yep, we can hear you.
Okay. Our center has been closed like everyone else. We've all been working from home, and we did an initial push in the first couple of weeks to outreach to as many people as we could to make sure that they have essential groceries and household items, and have put together a shopping service for a handful of people that couldn't get that need met through other sources out there. So we've done outreach to over 300 people now, and we're just doing follow up and reaching out to more people, really checking in on their essentials, prescriptions, groceries, household items, things like that.
And
that's
Dinah,
it.
Can you remind us who you're with?
Yeah, City of Lafayette Senior Services. Sorry.
Great, thank you. So next I have Elaine.
Hi, this is Elaine with Boulder Transportation Connections, and kind of like Commuting Solutions, we have the experience. We've already been working from home, so we're sharing sort of best practices with people. We've been doing some webinars, and we do have those available if anybody is feeling like they need a walkthrough, things like Zoom or Google Hangouts we've done so far. We will also have something tomorrow for people to just join a conversation of, how's it been going and what's next. It's really been fascinating to see this sudden surge into the telecommuting world. And, we hope a lot of people will actually stick with it after the fact. And of course, we're also pushing out the information from all the agencies on what's going on.
Great, thank you. So next I have Heidi Grove. If you just want to give a quick introduction, you'll have some time to do your discussion about transportation in a minute.
Sure, thanks, Angel. My name is Heidi Grove. I am with Homeless Solutions for Boulder County and Community Services, and I am the systems manager.
Great, thank you. And next I have Natalie Henlos, if you want to give an update.
Hey there, everyone. Yeah, we've all been working from home just the same. It's a lot of fun, actually. I'm really enjoying it. Hope everybody is well and also enjoying the working from home. I'm going to go ahead and in the chat put the link to the website where you can find all the information about COVID-19 on the RTD site. We have a lot of stuff going on, too much to list all at once. So I'll encourage everybody to go to that site. And I'm sure everybody has heard that we are going to implement the COVID-19 or PAN 20 service plan as of Sunday, this coming Sunday, April 19th. Basically, majority of services will go to Saturday level service with some exceptions. Some of the routes will have additional services, additional trips, such on the FF, for instance, the Bolt and some of these other routes will not just be straight up Saturday, but some extended service span as well as additional trips compared to what it would be for Saturday.
Great, thank you. And I do have another slide later on for RTD specific updates. So I saw Chris, I think, was on the line as well. So we'll be able to have a little bit more in-depth discussion here in a little bit. So next I have Jan. I'm not sure what your last name is, Jan. Jan, if you want to unmute yourself to give an update for your organization, that would be great. Okay, so we will go ahead and come back to Jan. Let's go to Joliet from Lafayette now.
Hi, can you hear me?
Yep, we can.
Hi, Joliet Woodson, City of Lafayette, Transportation Engineer. I am working from home. Sorry if you can hear my daughter. The city is just trying to keep going with essential services, and most of us on the staff side are just continuing to work from home and trying to keep our projects going.
Okay, thank you. So Jan, you have another opportunity to unmute yourself and introduce yourself if you want. Okay, next we'll go to Joni. Joni, do you want to unmute yourself and do an introduction?
Hi, can you hear me now?
Yeah, we can hear you.
Okay, this is Joni Lynch. I work at the Hour Center in Longmont. I'm the Family Resource Manager. We've gone through tremendous changes over the past month. We moved all of our daily hot meals and our weekly free groceries from our pantry to the outside of our building. So it's like a big giant drive-through. We do hot lunches 7 days a week, and we do free groceries from our pantry Monday through Friday during specific hours. We did scale our hours back slightly, just by an hour or two here and there. Our caseworkers are still working Monday through Friday full time, mostly from home. Everything is by phone, as you all know. They're getting a lot of requests from people who have been laid off recently. People are panicking. Every day here at the building, just for our food services, we're seeing anywhere from 150 to 230 people each day. That's hot meals and groceries combined. About 25%, maybe a little bit more, are new. The rest are regular participants. Our caseworkers' appointments, their phone calls for appointments have increased fourfold over the past few weeks. 75% of new calls are from Spanish speakers. We do have a bilingual receptionist here on site in the building, Monday through Friday, 8 to 5, answering the phone and connecting people to case management, to those appointments, and or, answering whatever questions people have. We lost many of our volunteers at the beginning of this crisis because so many were retired, and either they were worried about their own health, or they live at, somebody that they live with at home has underlying medical conditions, and they didn't feel that, that they could risk it. But a number of new volunteers have shown up and stepped in to fill the void. So we feel very lucky about that. Thank you.
Great, thank you. You guys are really doing a lot. I appreciate it. So next we have Kristen Lundy. If you want to introduce yourself and give update for your organization. Looks like Kristen dropped off. Probably accidentally hung up when she was trying to unmute herself. So next we'll go to Lisa Curtis from VIA.
Thanks. This is Lisa Curtis, and I'm from VIA. My colleague Lisa Bitzer is going to be on later to give a little more detail about what's going on at VIA. But as you probably realize, we do transportation contracts besides our paratransit contracts, and our revenue sources have just taken an enormous drop. But we're still conducting our paratransit services, and I'll let Lisa Bitzer speak to that. Thanks.
Great, thank you, Lisa. Let me see where we're at. Malia Munson, please. Next.
Hello, everyone. This is Malia Munson from the Denver Regional Mobility and Access Council. We have basically moved our information and assistance line to our website. If people are calling in, we still answer those phone calls, but we are keeping up with all of our transportation providers from our Getting There guide. We're in touch with them every 2 to 3 days, and we are keeping our website up to date with hour changes or different restrictions that they're experiencing during COVID-19, and we're trying to keep that and our front page up to date with resources.
Great, thank you. Next, I have Michelle Waite.
I put my mine in the chat because I need to sign off. I apologize. Stay well, everyone.
Thank you. So I have Michelle's update. She said that the Longmont Senior Center update, the Senior Center is closed, but all staff are still working. They're doing telephone information and assistance, including helping folks access financial support and also emotional support. The phone number to call is 303-651-8411. They're also reaching out to clients proactively. They have a phone meeting with independent housing managers tomorrow to see about what needs they have. The county has a list of providers doing pharmacy deliveries and also important food delivery. They're working with Cultivate and Long Mountain Meals on Wheels to do food. She has another call at 2:30, so she had to sign off. So that was her update. Next, we have Jacqueline Myers.
Hi, can you hear me okay?
Yes.
I'm a client services coordinator for the City of Boulder, Older Adult Services, and we, like everyone else, have been providing services from home remotely. Meals on Wheels is continuing to deliver in Boulder, increasing weekly, and so we're providing telephone consultations for older adults, and again, just trying to meet people where they are in terms of what their needs are. We're seeing a lot of requests for rent assistance, a lot of not so much food. People seem to be pretty good on food, but transportation has certainly been one of the things that's come up for a lot of folks. And so we're just doing the best we can. Thanks.
Great, thank you, Jacqueline. Lindsay Parsons, you're next.
Hey, Angel. So a few updates from the Boulder County Area Agency on Aging. We are available via phone and email. We've changed some of the previous restrictions that we've had on funding, like things for short-term assistance. So if folks are needing to access that program again, they can more than once now. We've been checking in with recent clients, so similar to what other folks have been talking about, reaching out to folks who have already been connected to our services. Michelle mentioned the link for food and pharmacy deliveries that's coming from us, so I can share that in the chat window so folks can see what she's talking about there. Recently, the focus has really been on those basic needs, especially nutrition. That's kind of been short term for the past month, and we're digging into some of the longer term needs that we anticipate for folks, like housing, bills, things like that. How can we support them? From my lens, there's been a lot more work in communication and advocacy. So working on really advocacy around the CARES 2 Act, so the second version of CARES, looking for additional funding for the Older Americans Act, national access to PPE, especially around long-term care and home health care, really addressing social isolation as well. That's another one of those longer-term things that we're really concerned about. And looking for flexibility for folks in their SNAP funds and looking for those direct payments to individuals as well. When it comes to communications, the Boulder County AAA now has posts in Spanish. We have had a huge increase in our Facebook audience and likes and followers and engagements there. So please follow us on Facebook to get some up-to-date information from us. We have many editions of Age and Well in Boulder County that have been coming out. There's been a lot of engagement around there. Our RFP has been delayed, and that was going to fund a lot of things, including transportation. We do not have a final date for that yet. We're just going to have to play it by ear for now, but we're continuing to fund those who we funded in the past. And our strategic plan is also going to be delayed because things have changed.
Yeah. Great. Thank you, Lindsay. Next, I have Chris Quinn.
Hi, Angel. Yeah, Chris Quinn with RTD Planning, and as Natalie noted, on April 19th, we will begin the reduced service plan to reflect the drop in both the drop in demand in ridership. And then the other big thing, and I'm happy to talk about this a little bit more later on in the meeting, although I do have to get off at 3. We have also suspended fare collection as a way of reducing interaction between the bus operators and passengers boarding. So now on all buses that have a rear door, passengers are to board from the rear, and then the front is chained off from about the wheelchair securement area back. So obviously ADA boardings would still occur in the front, but in general, all passengers will board from the back. And so we've suspended fare collection on all of our services.
Great, thank you. And I do know, hopefully we'll get there in time, but I'd like to know a little bit more about how Access-a-Ride, if you're the right person, how this Access-a-Ride food delivery is going. But we'll talk about that when we do the RTDs.
Okay.
Next I have Sandy Stewart. Sandy, if you want to unmute yourself.
Okay, now I'm unmuted. This is Sandy Stewart, and I'm with the Longmont Transportation Advisory Board. And I just a brief update. We had a meeting with RTD in March, and they gave us an update on our plan that we've been working with them with Ride Free Longmont. So Natalie was there and Chris was there as well to talk to us about what had been going on and projections of people, ridership over all the different routes that we have in Longmont. And we didn't have a meeting this month because of, well, we all know things have kind of changed for everybody. But we also talked about the Northwest Rail and the meeting that they had held in February, talking about the railroad and RTD and whether Longmont will ever get the rail up there for buses. So that's all that we've got going on at the moment. Thank you.
Great, thank you, Sandy. Next I have Rebecca Seiden.
Hi, we have been continuing. I've met twice with the advisory council.
Can you remind us who you're with, Rebecca?
Oh, I'm sorry. I am with Impact with Housing and Human Services, and I am the mill levy coordinator. We have met twice. Our last meeting, we are looking at setting up some emergency needs for IDD. And we're just in the process of looking at housing and supplies that various agencies and individuals need, such as cloth masks, etc. We are actually going to do kind of a little campaign, and Anna Stewart's on the phone as well. ACL is collecting cloth masks, and from my understanding, they will be giving those out to people that need them. And there is a high need for persons with IDD because often they don't understand what they require to protect themselves. So we are kind of looking at what our emerging needs are right now and hopefully being able to satisfy those.
Great, thank you. Next I have Stephanie Schuller. Stephanie, if you could unmute yourself and give an update for your organization, that would be great. So we'll circle back around to Stephanie. Let's go with Tim Beal. Can you please provide an update? Oh, never mind.
I just ran into the bathroom.
Oh, sorry.
This is Stephanie. I'm from Golden West Communities, so we're an independent living and assisted living community. Our world has been turned upside down with COVID-19. No group activities, no communal dining, and only allowing essential visitors into our campus. So a lot of new policies and procedures changing every day, and also getting creative with our activity planning so we can, kind of take care with those that may be feeling a bit isolated right now.
Yeah, for sure. So I'll send out a link after this, but Senior Planet is doing a lot of engagement activities online for seniors. So that might be a good avenue to reduce social isolation.
Awesome. Thank you.
Great. And then Tim Beal, do you want to give your update?
Yeah, hi, Tim Beal from Boulder Housing Partners. We are trying to be a good hub for all of our 3,000 plus residents and connecting them to support and services of many of the folks on this call. We've just really tried to make an effort to make personal contact with everybody because not everybody has access to computers. We've gone down to literally noticing every property so that people know who they can get in touch with when and how, and so that we can connect them to anything that they might need. But thanks for everybody's great effort in the community.
Okay, thank you. So we're still here. It's just the presentation died. Next I have Whitney Wilcox.
Hi, everyone. This is Whitney Wilcox with Boulder County Housing and Human Services. So like all of you, we've spent the last few weeks transitioning our teams to teleworking and also figuring out how to deliver our services remotely and to do that more efficiently and effectively. So all of our essential services such as child and adult protection, as well as benefit application and assistance, for SNAP, Medicaid, TANF, child care assistance, those are all services that are being offered remotely. People can call our regular number or text or email, which is 303-441-1069. We have seen a significant increase in applications and questions from folks. So I have been told it can take up to 3 days to respond. So if you have any people that you're working with that haven't heard back immediately, I do understand that we're over maxed out, as I'm sure many of you are, and so it can take a few days to hear back. That's it.
Thank you. Next we have Zoe from VIA.
Hi, this is Zoe DeVito from VIA Mobility Services. Not to be redundant, so we are interested in discussing ideas for collaborations on virtual meetings to engage our target populations, being older adults and people with disabilities. So if you're interested in that, please contact me. I'll put my email in the chat.
Great, thank you. So there's a couple of phone numbers. Go ahead, I will give a couple of seconds for you to hop in and introduce yourselves if you haven't already.
This is Lisa from VIA Mobility Services. Can you hear me?
Yes, we can hear you, Lisa.
Okay, I'm having computer problems, so I'm only on for the phone. So Lisa Bitzer, Director of VIA Paratransit and Mobility. We are open for business. And we can discuss more in length here about what we're doing and how we're meeting the needs of the community.
Great, thank you. So the next person on a phone, if you want to hop in, I don't have any names or anything.
Hi.
Hello, can you introduce yourself? Yeah.
Yeah, this is Sue Prant from Community Cycles.
Hi, Sue. How are you doing?
Good.
So do you have any updates for community?
I mean, we're closed, but we are still doing our advocacy work and trying to get some street closures so people have room to walk in the streets safely and trying to get some speed limit reductions. We've been working on this for a long time, but it's more important now that people are walking in the streets. And that's basically what we're working on.
Yeah, wonderful. Great.
Thanks. How do I remute?
I can mute you from the other computer.
All right, thanks. Bye.
Thanks.
Hi, can you hear me?
Yes, who's this?
Yeah, this is Kristen Lundy. I am from Imagine. I'm the case management program manager. So, sorry, I couldn't get my audio to work earlier. We've moved all of our care coordination to Zoom at this time. All of our face-to-face meetings required by HICPUF are being done remotely, so over the telephone or ideally with some sort of video capacity. For anybody that's eligible for our services or in our services, we've really kind of lightened the requirements for emergency funding usage and made some other funding sources available for them at this time. But we're just adjusting every day and trying to keep up with the requirements from the state that are changing on a daily basis.
Great, thank you. Is there anybody else that wants to introduce themselves before we move on? Okay. So I'm going to go ahead and slide maybe. Okay. So we're going to hear, we're going to have a short, so what I heard during those updates is that both Homeless Solutions for Boulder County and also RTD need to do their updates around their more in-depth updates surrounding COVID first. So we'll go ahead and start with Heidi. And Brandon, you might want to unmute towards the end of her conversation because it does directly pertain to the request that you had sent last week. So Heidi, if you want to just tell us a little bit about what Homeless Solutions for Boulder County has been doing to transport people with who are experiencing homelessness, that would be wonderful.
Sure. Hi, guys. I apologize. I have to jump off on another call in 15 minutes. So we've done a few things in response to COVID. So for those of you who are familiar with our coordinated entry process, we've moved that completely remote. And I can include that link to all the information and the phone numbers and the times in the chat. The other thing that we've done is, as many have seen probably in the news, we did set up what we're calling the CRC, or COVID Recovery Center, and it is repurposing one of the rec centers in Boulder. And so anybody who is presenting symptomatic at any one of our standing shelters is actually transported to the CRC. And then we are using Parks and Rec vans for both City of Boulder and City of Longmont to make sure that that transportation is seamless. And at any point in time, whether it's 3 in the morning or 3 in the afternoon, we do have staff available to go ahead and drive to the shelter locations and get the individual to the CRC. We're also doing transportation between the CRC to Clinica so that people can get tested for COVID. While they're waiting for their results, they can stay in isolation or quarantine at the CRC until we find out if they do have COVID or not. So the other piece too, because we have access to the Parks and Recs vans, is when we have shelter overflow needs, we're also repurposing those vans to transition people between shelter locations.
Okay, wonderful. So Brandon, you had emailed me last week asking if I knew of providers who are willing to transport people experiencing homelessness who had had symptoms of COVID-19. I don't know if you want to elaborate on that request, like what you guys are trying to do as far as inventorying all of those providers.
Definitely, yeah. So we are looking for providers who, we kind of got wind about the CRC, and that's awesome. I think that's a great service to have. But one of our providers was looking for how can we transport folks who might be experiencing homelessness, who might also be presenting COVID-19 symptoms or have already tested positive, to get them transported potentially from their primary care doctor to a shelter similar to the CRC. And that's kind of where it's just hard to find folks, first of all, who are still operating right now just with COVID-19, but then to find folks to specifically take them from primary care doctors to shelters that are accepting individuals who might be positive is kind of sparse. So that's what we were looking for.
Okay. So, and correct me if I'm wrong, but the challenge is that time issue, right? So being able to request a trip the same day, which the Medicaid, yeah, the Medicaid transportation system isn't equipped to handle really. And then also just providers that are like have the PPE or are following certain protocols to protect the drivers from somebody who is a confirmed COVID. Is that also a component of it?
That's correct, yes.
Okay. And have you had any success identifying any transportation providers to fill that niche?
I have. I believe I found two. One was kind of more of a local place in Jefferson County. And one, let me pull up the notes. I believe it was a Key Transit and Prime Care. So they were still operating more or less business as usual and following CDC guidelines to protect their drivers and things like that. That's about the only two that I found outside of Resources Connect to the CRC. Thanks for that information, by the way. I did not know that you guys were repurposing vans and utilizing Parks and Rec as well. So I'll definitely add that to our database and tell my team that as well.
So I will also send out the request that you sent last week, Brandon, to our LCC list. And just, I mean, I think that I had spoke with Invita from Colorado Springs, and they were maybe in like the planning stages of something similar to this. But that's a different region for you all, for the Ray. And so I think that if there are providers on the line who would be interested in filling this niche of, the need right now, then we could probably connect with a different meeting specifically. But I don't know if anybody wants to hop in, if they have any updates or any considerations for CCHA's request or need to provide this specific transportation option.
Angel, can I respond to some of those questions?
Yeah, sure.
So we are repurposing those vans, and all the drivers are either city or county staff per our insurance requirement, and every driver is completely geared up with PPE, and we do disinfect the vans after each trip.
Okay, and you only have one person per trip, correct?
They're large enough that we can do two symptomatic because of the social distancing within the space, because they're like the giant 16 people vans. But for people who are non-symptomatic, we can do more than that as we transition people to and from shelters. But like I said, those vans are completely disinfected after each trip, whether people are symptomatic or not. And we have, because the county generously leveraged some of the general funds to hire people to staff the CRC, we have enough staffing capability to have a staff member leave the CRC to go and transport at any point in time.
Okay, wonderful. So if we don't have any more updates on that, I'd like to transition to RTD and give Chris an opportunity. It looks like he has about 8 minutes before his next call. If you're still on the line, Chris, would you like to go into more depth about RTD's changes?
Yeah, and certainly Natalie can speak to the specific service changes far better than I can, since she was the one who actually developed them. But just one quick thing to focus on. Natalie just said we weren't sure what the numbers were, but we just received back from our ADA department, and so far this month, 60 grocery. And let me back up a little bit. Our Accessoride is now offering to pick up groceries for eligible Accessoride customers. As long as the order is placed the day before, the order has to actually be placed by the customer themselves, and then through our Accessoride, we will pick it up either from a participating grocery store or from a food bank. And so far this month, we have completed 60 deliveries, and most of those were from grocery stores. So we're certainly considering that a pretty good success. And I'm trying to think if there's really anything else of note. Natalie, please jump in if there's anything you can think of as well.
I think it's just, there's so much information. I went ahead and put the link into the chat for the RTD website. I think the most important really is for everybody to realize that the service changes this coming Sunday. And please go ahead and go and look at the route specific, because like I said earlier, several of them are not going to just operate plain Saturday service, but they are going to have additional trips based on demand and need that we're aware of. So if you have any questions specifically, feel free and email and let us know, and we'll try to get you the specific information as best as possible.
Okay, great.
Oh, and I'm sorry, just a couple of other very minor things, but also one of the things we are doing is trying to monitor the ridership as well, so that right now we are trying to limit the number of passengers on the standard 40-foot buses to a maximum of 15. Drivers do have the have the option of bypassing stops, notifying dispatch, and have another bus summoned if crowding is starting to take place on a specific route. So definitely something we're paying attention to make sure that people are able to keep their distance while on the bus.
Okay, great. And just to clarify, for new Access-a-Ride clients, they are presumptively being awarded eligibility until they can do the in-person, the functional assessment. Is that correct?
Do you know, Natalie?
Yeah.
I don't know.
Yeah, that's correct. And everybody is grandfathered in at this point, even though through the May 20 service changes, there would have been adjustments to routes and adjustments to the ADA. Everybody who is currently in the program is grandfathered in.
Okay, great. Thank you so much. So real quick before 3 o'clock, I'd like to move on to Cultivate. Christy, are you still on the line? I know you have another call as well.
I am still on the line, and thank you. Do you want me to talk about our carry-out service right now?
Yeah, what specific gaps do you have, or how could we be of assistance for you all, or just how can we get the word out to our clients?
Sure. So actually we are doubling our enrollment every week. We are still shopping in Boulder and Longmont. So far we have not reached a point where we're having to close our enrollments, which is amazing. In fact, that program is expanding into Broomfield as well. We're going to start a physical shopping day in Broomfield next week because of that overwhelming demand. So our program is growing week after week after week. So please just keep sending people. Dinah, if you're still on the line, that Broomfield store will also service Lafayette specifically. So go ahead and send your Lafayette seniors our way, and we'll get them enrolled and get them into grocery. One of the things that we're doing in response to COVID is that we've partnered with several organizations, including Team Rubicon and the Tebow Properties and a few others, who have provided us some property for decontamination sites. So what we're doing after the groceries are shopped is that those groceries are being taken to these decon sites that are staffed by Team Rubicon volunteers. Each of the grocery items are being sanitized and placed into clean, sanitized grocery bags, as to reduce the amount of germs and virus that we may be sharing or spreading prior to that delivery going to the doorstep of our clients. So we aren't putting the groceries away anymore. We're not going into clients' homes, but we are providing personal protective equipment for every single one of our volunteers: gloves, masks, if they don't already have it, plenty of hand sanitizer, training on really how to handle these groceries, sanitize your hands before they even come get the groceries, providing them, if they don't already have it, a way to sanitize where the groceries are going into their vehicles. So we've every single grocery order is going through this process, and that is already happening in Boulder and Longmont, and it will just be an integrated component of the Broomfield site as well.
Great, thank you.
You're welcome. So yeah, I guess, sorry. At this point, you know, just if you hear people that, you know, 16 over that need groceries, go ahead and send them our way. And we're getting people enrolled as quickly as we possibly can for service.
Great. Thanks a lot.
Mm-hmm.
So next we have VIA Mobility Services, and Lisa Bitzer, I believe you're going to be providing the update for this. Lisa? Okay, I don't see Lisa on the line. So, what's that?
You don't mean Lisa Lundorf, do you?
No, I don't. I mean Lisa Bitzer.
Okay.
She may have called in. It sounded like she was having computer problems.
Yeah.
So she may not be on the.
So, Lisa Curtis, I don't know if you want to, if you feel comfortable giving this, or we can circle back around if she does call in.
You know, I can just start briefly, and then maybe she could fill in more details if she calls back in. VIA is still rolling with our paratransit services. However, most of our services are now kind of going in the reverse direction. We're delivering groceries to people. We're down in terms of people going out to go grocery shopping. But for those paratransit rides that we do provide, we're limiting riders to one person at a time, and we're cleaning the vehicles between trips. We're also delivering food from food banks and senior centers to people. We've been taking, excuse me, boxes of food to people in the mountain communities and also to Lions, but up to Allen's Park as well. And we've been partnering with a number of nonprofit agencies to do this work. And I'll let, the other things that we're doing, we're taking people to dialysis appointments. These are new clients, a lot of them. And we're also stepped up and to help. There was a volunteer program. Oh, Lisa, are you there?
I am. Can you hear me?
Yeah, we can hear you now.
Oh, okay. I've been here the whole time. I'm not quite sure why you couldn't hear me. Yeah, thanks, Lisa. We're doing a little bit of everything. We've partnered with Children's Hospital in Broomfield because when children need to be transferred to their hospital down in Denver, parents are not allowed to ride in the ambulance with them. And so we have partnered with them to get the parents down there so that they can be with their children. Like Lisa said, we're working with the farmers market. We're working with just about anyone and everyone that is needing groceries, picking up prescriptions, you know, needing to go to places that normally we don't go. Like today, a gentleman was moving from his home in Boulder to a senior living facility in Loveland, and so we did that trip for him. We have a lady that is lives in Boulder and has to go to Fort Collins for medical treatment. We're going to do that appointment for her. So we're doing everything that we can, keeping our rides to one person per vehicle. If for some reason there's two people from the same place, their buses are big enough where we can separate them out and have plenty of distance between them. We're picking up boxes of food and taking them to the Longmont Senior Center, to the Louisville Senior Center, delivering food to the seniors in Lions. And basically, you know, anything that we need to do. We still have a couple of people in the call center that are answering calls. My mobility specialists have split their time between home and the office individually. And myself, I'm working from home and also taking all the calls coming into the main line of the company. So that's about it. Anything and everything we can do to help the community.
Okay, wonderful. I don't know if you have any comments or questions on the request from CCHA to transport individuals with COVID symptoms experiencing homelessness.
Yeah, we we have discussed that, and at this point in time, that is just something that we can't do. Our drivers aren't trained, nor do we have the equipment to be able to do that. So unfortunately, the answer is no at this time.
Okay. Okay. Well, we'll continue the discussion. So next, well, RTD already did their update. And then also, I just wanted to point out also that Commuting Solutions, that they're hosting a webinar this Wednesday, I believe, with our two directors on the RTD board to talk about all these service changes. And Natalie, I believe you're also on that panel. So if you want more in-depth RTD information, then that webinar is also available, and I'll send that out afterwards. It was in the newsletter that I sent out last Friday. It's in the events, upcoming events, so you can register for that to get a little bit more RTD information. As far as Mobility for All, we've postponed all of our technology workshops, and right now we're, just because the senior centers, they have about a 3 to 6 month lead on when they're scheduling for their catalogs. I think we're going to go ahead and try to schedule those technology workshops in the fall with the senior centers. But we have also talked to the Center for People with Disabilities about possibly joining in on some of their peer-to-peer groups to do some technology education on those peer Zoom meetings or Google Hangout meetings. Also, we've collected all the information to promote the RTD Live program, and we're going to postpone the engagement effort of that. What we had talked about doing was partnering with the Peak outreach coordinator for Boulder County and working with direct service providers like Sister Carmen or Our Center or EFA to try to get their staff trained on how to encourage people to sign up for the Live program. And then once they had people sign up for the Live program, we were going to be able to subsidize some of the Live passes once they already had the card. We're postponing that until we can do in-person training. And also just kind of taking advantage of this more downtime due to not being able to do in-person outreach events and meetings. And we're going to be doing a program evaluation and strategic plan. One update, so you will be getting a request to fill out a survey for Mobility for All, just to let us know how we're doing and how we can improve. And then one thing that I didn't put on here is that we are moving forward, Boulder County is moving forward with the on-demand transportation service in Lafayette. So due to RTD's driver shortage and some of the service cuts that they had, they didn't feel comfortable taking on a flex ride service this year in Lafayette, which we had applied for a grant to fund. So we're going directly out to with an RFP, which is open currently. And we have a few people who are asking questions, a few providers that are asking questions about that. But we would like to still continue moving forward with the contracting of that and everything. So I think July 1st is what we're aiming for to do an on-demand service in Lafayette. Of course, it really depends on what the COVID situation is like, but we're still moving forward with that project. And another thing I wanted to point out is there's a link in the newsletter that I sent out last Friday, but Boulder County COVID resources. We do have a webpage that consolidates all of the transportation and all the other resources. And it has things like rental assistance and just everything in one place. So you can see at the top, here's the URL for that. So it's also in the newsletter if you want to go back and look at the newsletter under Boulder County COVID-19 resources. So I haven't really connected with the HHS people, but I don't know if Whitney or any of the other HHS people have any more insights about what the requests are that you're getting for support.
Not for transportation specifically, but definitely for other services like housing and rental assistance and food. Childcare. Yeah.
So I know that childcare is definitely something that has been an issue in the press. Are there childcare services available for people who are essential workers? And how do you deal with those requests?
I can look some of this information up because I don't want to repeat anything that's wrong. And there's a couple of other folks too, if people within the department, if people have questions specific to childcare. But an emergency child list state set up an emergency childcare collaborative a couple of weeks ago, and so my understanding is the request if you're on the front lines and they've defined that collaborative has defined who that is that's eligible for those services can sign up for services on that website, and then those folks will be matched to a childcare provider.
Okay, wonderful.
Okay. And actually, I think there's probably, so the same page that Angel has up right now, if you back up the transportation piece, if you ended at COVID-19 resources, I think there's actually a child care section, and it probably has the link to that information too.
Okay, and I think that let me see here. I can go ahead and go to that. Let me see really quickly. I can show you the actual web page. And I did send this out, so I mean, you can explore it on your own. But let me go ahead and just show you a little bit more interactive. So this
sorry, Angel, it is there, the Colorado Emergency Child Care Collaborative. There's a link to that under the child care section on that larger resources page.
Okay, wonderful. So you'll see here that there's all of these topics. Transportation is the bottom there, but and the transportation was just me kind of like searching all of the newsletters that you all were sending to me and just putting it in one place. So if there's something that's wrong or you'd like updated, just let me know and I'll work with our communications staff to get the transportation updated. But you'll see that they have these little accordion links, and then you can just explore all of the different options underneath those particular. There's some that are redundant. So for example, some of the transportation was listed in multiple locations. So I think that for food assistance, Cultivate was listed under there. And I'm not sure, I think it was before everybody else started doing grocery delivery. So like, I don't think Via is actually on here, but Accessorides, oh yeah, you are. So I put some of the transportation providers that are delivering food in this section as well, the mail and grocery delivery. But there's everything that I could think of. I'm sure that there's some things that are missing off of here though. So if you all wouldn't mind taking a look at that and giving us updates or changes on here, that would be great.
Hey, Angel.
Yeah.
It's Lindsay. There's additional information under, it says services for older adults now. They changed the title of it about all things meals and delivery, and links to the Google Drive that Michelle mentioned earlier as well, or at least it should at this point. I sent the updates in.
Okay. And so there's Meals on Wheels under grocery delivery, shopping hours for older adults. And then another one that another website that I wanted to point out to you all was Via's resources. Let's see. Resources for social distancing. And this is just, this is when we talked about isolation. They have some really good resources on here to help people who are experiencing isolation. So they have like the meal deliveries on here as well. But then they also had online exercising, pet care services, faith services, messaging apps, digital resources, streaming video services. So it goes more into depth into things that you could also refer people to, because we know that isolation is a huge issue for people who are vulnerable. And then Senior Planet also has, and you can see here, seniorplanet.org/locations/Colorado/events. I sent this to Via as well to include on their social distancing resources. But they have a bunch of online classes for people that are conducted over Zoom. So there's food delivery apps, there's podcasts. And so it really does not assume that people know how to access all of these things online. So there are more and more things available for people who are homebound due to their vulnerability for this. Okay, so does anybody have any other questions before we move on to the census and hand things over to Craig? Okay, so go ahead, Craig, if you can unmute yourself and just talk to us a little bit about the census. We all know that it's really important now, but I'll let you have your time here.
Yeah, thank you so much for saving a little bit of time for me to chat at the end here and briefly talk about the census. And I know that we all have a lot going on right now and we're all working really hard to navigate this unique time that we're all living through, but it's really important to not forget the importance of the census and how much value it's going to bring to our communities for the next 10 years. So I wanted to provide some information that's going on right now and to remind everyone to please pass that on to your consumers and communities so that we can try and boost participation. And with the Center for People with Disabilities, our outreach is primarily focused on hard to reach populations as well as traditionally lower participation rates, and that's people living with disabilities that are traditionally lower participation. So we're focused on our community members to get that up. And in doing so, we want to help provide resources that remove barriers with participation. And that can range from anything that has to do with language barriers to large print guides. And we also have Braille guides available. And we also have MP3 players with preloaded census information listed on them. And just anything that we can do to help make the census accessible to every type of person in our communities. In the chat, I'm going to drop down a couple resources that we have, as well as my email address, because I want to open myself up to be a resource to each and every one of you in case you do have questions specific to accessibility of the census or just looking for more information. We have a tutorial video that goes into detail about what the process is like when you're filling out the census online, as well as a video created by the Colorado Center for the Blind, and that goes through the process of taking the census using a screen reader. And yeah, those are the main points. And then, as Aaron mentioned in the very beginning, the Center for People with Disabilities has moved all of our peer support groups online, and that's been a really great way to have face-to-face contact with people and in our community and answer questions specific to the census. So if anyone else has these same opportunities where they're bringing events online like this one, please reach out, and I'd love to kind of piggyback on any standing meetings that are going on to just kind of go over the census information and answer questions firsthand and have that face-to-face communication in case anyone's interested. So please feel free to follow up with me via email. And again, it's in the chat box, just craig@cpwd.org. And yeah, that's just my little quick census talk. Thank you.
Great, thank you. So let's see. So there are quite a few updates. So Zoe, so I'm just going to go ahead and read off some of these that were in the chat for people who aren't comfortable accessing the chat or who are on the phone. So Zoe mentioned that VIA is going to host some online community events for writers. If you want to partner or have any ideas, please email Zoe at viacolorado.org. So that's ZDEVITO@viacolorado.org. And I will email those out when I have the notes. Also, Jen Briggs is on the line. Jen, we skipped over you during the updates. I don't know if you want to unmute yourself and give an update for American Cancer Society.
Sure. I apologize for being late, everybody. We received some disturbing news earlier today where we had to put some of our staff on furlough. Thankfully, I learned that their insurance benefits are going to be covered but it was something I needed to navigate a little bit with some of my coworkers. I wanted to share that we are continuing to be a resource for cancer patients amongst this outbreak. So our services are paused, but if you were to, and I'll put it in the chat box, go to our website, cancer.org. Right at the top, we have information about like what cancer patients and their families need to know about the coronavirus. We also have a link that showcases how it's impacting our patient services. And so like those are 2 links or pages that we'll be keeping updated often. Our Dr. Len, he's a senior medical doctor within our organization. He's hosting some podcasts for people, as well as like short videos on YouTube. And so if you want, I can send you those like 3 key links. Angel, are we doing notes for this meeting?
Yeah, we are. So that would be great. If you could put it in the chat, that might be easiest.
Okay. And then in the chat, I did put in something that's outside of my organization. It's something that I learned about from my apartment complex. It's called C19 Help Squad. And so if it's something that you would want to check out, I signed up to be a volunteer. I haven't actually had an opportunity to give help, but it's something, honestly, it's like a political campaign organization that has created this. They call themselves PAC for short. I am unfamiliar with them. Just the fact that they're called the Action PAC, PAC. They say that they do not authorize any candidate or candidates committee, but they're organizing volunteers to help in different communities. And so that's what I found really valuable, including food delivery and transportation. So as they mobilize volunteers in these different communities, and they also take in requests for help, including financial assistance, they're working with their volunteers to like navigate those needs. And so I thought that was like a helpful resource to share.
Okay, wonderful. Okay, does anybody else have any other updates? Looking through the chat, Rebecca had mentioned something about masks, and she can coordinate. She said for masks she can coordinate, and her email is rseiden@bouldercounty.org. Again, I'll put that in the notes of the meeting. But from what a previous meeting that I was on right before this, I did hear that Boulder County is purchasing some masks for the other organizations can tap into. So I think that some of the smaller organizations, they didn't have the capacity to buy like in bulk a bunch of masks, but they still had some need for masks. So I think that Boulder County, and through our ESF, so our emergency response system, I think that we were purchasing some masks, and I'll get clarification on that before I send it out in the notes. But it was a way for Boulder County to kind of be that intermediary for smaller organizations that couldn't meet the minimums for ordering a bunch of masks. And I'm not sure if anybody else from Boulder County has any updates on that, Lindsay or Whitney. Or Rebecca.
Angel, I heard that nonprofits that were providing essential services could order masks through the ESF because they were placing bulk orders, but that the nonprofits would be invoiced by the county. So
okay.
That's maybe a little different than what you heard.
No, I think that's the same. I think I just described it. Yeah, I just described it in more roundabout way. So
I just wanted to make it clear that the county unfortunately wasn't paying for.
Oh yeah. Okay. Okay. So did anybody else hear any other needs or have any other solutions that they identified during this meeting? Okay. Well, thank you so much. I really appreciate it. I know it's challenging to meet online, and it was nice to see some of your faces. I know it's kind of intimidating using the camera sometimes, but it does help with that personal connection. So I do appreciate you guys using your camera. And I will tentatively schedule the May LCC for virtual as well. I've already created a link for it. And if you have any updates that you want me to include in the Boulder County Transportation COVID updates, please just send me an email and I'll update that website. And if you have anything else that you forgot to give updates on, just go ahead and send me another email. But I hope you all are well and safe, and I can't wait to see you guys in person sometime soon.